Well, good morning, good afternoon, good evening, wherever you are in the world. Ladies and gentlemen, welcome Dr. Pamela Dragos. Hi, Dr. Dragos.
Hi, Rob. Thanks for inviting me.
Thank you for coming. And you're over in the Phoenix, Arizona area, right?
I'm in sunny Phoenix. Absolutely. It's almost 100 degrees already.
Yes, in the end of spring. But I love desert weather a lot. I used to live in the desert and love it. But in the desert, there could be, you could have a dog that gets valley fever, and you have a course about valley fever. Is that right?
Absolutely. I have an online training program for dogs with valley fever.
Great. So we'll have a link. We're going to put this up in a sec where you guys can find the course. But I want to ask you a few questions. So first and foremost, what is valley fever?
Valley fever is a really weird fungal infection that is in the desert. So the desert Southwest. And it lives in the soil. And when it rains, it grows in the soil. And then when it dries out, it goes into the air and we breathe it in. Dogs and people and all mammals, and we can get infected.
Okay, wow. And so because it's fungal based, it causes a fever, but it's not to be confused with like a virus, like a flu or something. It's fungal, it causes a fever, right?
Yes, it's fungal, and it usually causes a fever initially, but it can be confused with viral infections and bacterial infections because it just causes flu-like symptoms, which can be confusing.
Wow. And when you said it goes in, so it's in the soil, it obviously funguses love moisture, so it blooms. Well, I'll use these unofficial, simpler terms. It sort of blooms, and then when it dries out, the spores get in the air. Am I onto something?
Yes, they're kind of like little seeds. They're little tiny spores, and they're microscopic, and they become airborne, and they get into your lungs when you breathe, and you really can't avoid it.
Yeah. So what are the signs of valley fever in a dog?
So the symptoms in dogs of valley fever are generally flu-like symptoms initially. So fever, lethargy, coughing, and they can also have joint pain or stiffness, and just feel lousy and not want to eat.
Okay. And so how can I treat my dog's valley fever at home if I notice that my dog has it?
Well, the first thing you want to do is confirm it with a blood test. So generally we do a blood test first to confirm it. But for treatment, likely you're going to need some antifungal prescriptions. So you'll need to have a veterinarian on board. But for treatment at home, there are things that you can easily do to help your dog's immune system. So diet's going to be important. Supplements are going to be important. And then there are herbal remedies for fungal infections.
Yep. And what happens if you don't treat valley fever in dogs?
So if a dog gets valley fever and is not treated, a portion of the dogs will get better on their own. But you don't want to take that chance because some of the dogs will develop a severe pneumonia, and then it can go to other parts of the body. So it can go to the joints and the bones and the central nervous system and the brain and the heart, and it gets disseminated, and that's really hard to get a handle on.
Okay. And in what states can dogs get valley fever?
Valley fever is generally in the Southwest United States. So Arizona, California, New Mexico, into parts of Texas, Utah, Nevada, and now we're finding it in the state of Washington, interestingly enough, And that's because of global warming.
Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. You mentioned immunity and supporting immunity and resilience. So these dogs that get it in their joints and everywhere else, a fungus essentially takes over. It's kind of like, people who are in a house that has mold and they get all kinds of horrible symptoms. Is immunity, would you say, is immunity like the first line of defense?
Oh, absolutely. That's how we prevent valley fever, is making sure our immune system is tip top. And then part of treatment, yep. And part of treatment would be to boost that immune system so they can help get over it by themselves.
Yeah. I tell you, the more that I live, every single day I'm alive, it is just clear as day. The number one way to play offense is good defense on your immune system. And our pets too. And at our company, Gussys, we always use the R word, resilience. And I'm just echoing what you said, which is an incredible diet, really high quality, very high quality supplements. And those things really that keep the immune system alive and very vigilant and happy. It keeps it scanning its environment constantly. We could never work this hard. I mean, the immune system's amazing. So, tell me what your feelings are about that.
The immune system is key to health. So supporting the immune system, especially with diet, because nutrition is the number one determinant of a healthy immune system. So diet and immune system go hand in hand. You need to be on a healthy diet to have a good immune system.
Yeah, amen to that. So you've been a licensed veterinarian for 33 years. You have too many very amazing, like your bona fides is like super. It's a scroll. So we're not going to get into it all. I mean, just a quick Google search, people. If you're in the Phoenix area and you want Dr. Dragos to be part of your healthcare team, or if you're outside of Phoenix and would like to do Zoom sessions, you also do telemedicine consultations with clients anywhere. Is that right?
That's primarily what I'm doing right now, are the telehealth consultations via Zoom all over the United States and, in fact, in other countries.
Yeah. So tell me what you think about, how would you explain telemedicine to somebody who doesn't even know that they can get an amazing 33-year veteran holistic veterinarian on the phone to help them with their issues? How do you think about, and they say to themselves, well, I'm in Brussels, I'm in, Venice, Italy, or where, how is she going to help me? What would you say to that?
Oh my goodness, there's so much you can do. So with a telemedicine consultation, first I get a hold of the patient's records and I go over everything from as far back as you want. And I determine what the underlying causes of the particular problem that the pet is having. And then I can recommend diet changes and specific diet changes based on the pet's problem and the pet's personality and all the other issues going on. And then I can recommend herbs and supplements and things like mushrooms. And we talk about physical therapies like acupuncture and chiropractic. And I can refer you or them to someone that can help, or even just teach you how to do acupressure at home. So there are so many things that you can do with telehealth.
Yeah. One of the things that you haven't mentioned, but I want to just put a nice little plug in for all telemedicine, all great vets that are, and there's a lot of great vets out there that are doing telemedicine. You're helping somebody think through properly in an order and with a plan and a strategy. So I think one of your biggest value adds, I mean, it's amazing. You look at blood tests. That's all incredibly important. You look at history, you look at diet, incredibly important. And obviously at the top of that list. But the other really amazing thing I think that people leave, the people I talk to that have telemedicine appointments that have never had them and that just like their aha moment is, she helped me think properly about this problem and how to attack it in an order that made sense, that wasn't making me absolutely crazy, So I think that's a huge value that everybody needs to understand. It's really like because your hands are not on the animal, you are being almost like a advocate, a second opinion, whatever you might want to call it. You're acting as this other set of eyes and ears for the owner and the dog or cat.
Yep. I'm definitely a second opinion and more like a detective, because I have to really scope through all the records and find things that maybe are missed. Yeah.
Dr. Billinghurst, when he consults, he says he interrogates his consultations, because it's in the interrogation, it's in asking the right questions that you get the real answers. Because some people don't even know that they should be bringing up that their dog drinks out of the toilet and there's a blue toilet bowl cleaner in the toilet or whatever. There's all these little things that people just don't ever think about that are really important. And really amazing holistic vets, they pull out all of those little nuggets.
Yep. And holistic medicine, especially your TCM or your Chinese medicine, knows answers for every little thing. And, conventionally, no one would care if your dog got up at 3:00 in the morning, but holistically, that means something.
That's exactly right. Yeah, I have experience of that in my own life, that I had a sleeping disorder for 14 years. I went to the best neurologists, best sleep disorder clinics in the world over that 14 years. And I went to this one doctor who's still my doctor and my hero. I mean, he's a genius. And within one consultation, I filled out a whole interrogation paper. I mean, it was a really thick thing of paperwork. I looked at it and I was like, oh my gosh, I almost canceled my appointment. And I filled it all out. And he was sitting in the appointment waiting for me. And I'm getting to a point here because I think this is what having a holistic consultation is like with a veterinarian. Okay. Mm-hmm. Holistic veterinarians, they operate differently. They work with clients differently. They have longer sessions. They're much more like 180 degrees around problems, or 360, however you want to look at it. Mm-hmm. So the point I'm making is I filled out this paperwork. He was sitting in the office. I walk in the office and we shook hands and he said, thank you for filling out this paperwork. I think I might know what's going on with you. And then he asked me some more deeper questions. Mm-hmm. He prescribed some holistic, homeopathic, natural things. I was getting up all the time in the middle of the night at between 2 and 4. That's exactly something you mentioned.
Yeah.
It was my liver.
Yep. It's liver cheese.
And so he pulled that out. And I said, liver? I said, what? Like I wasn't a drinker, drugs, healthy, exercise. I'm like, liver? So and it was related. Well, yeah, it was that. And it was also related slightly to like a gluten intolerance, mm-hmm. And I was going a little heavy on that. But he gave me some cleansing tonic things. And within 4 weeks, I slept my first night through the night. A miracle. Because that only happened in a year, maybe 2 or 3 times in a year. So it was 4 weeks away from that appointment. Then they kept adding and stacking. And then within about, I don't know, 3-4 months, something like that, I was sleeping several days throughout the week. Miracle. And then I completely cured and never looked back. It's been over 20 years. So this is what I'm trying to tell people. I have this passion for trying to get people to sound the alarm of like, folks, like, stop ordering these insane, silly products that grab your attention on Instagram and going from one product to another and giving them no time to work. And some of them are complete junk. I'm sorry. Some of them are, but they're grasping at straws. Stop grasping and get with somebody who just build a really great healthcare team for your dog and for yourself and your cat.
Absolutely. Yep. Stop, save yourself some sanity and some time, and, don't go down those rabbit holes trying to figure things out. Go find someone that knows how to figure it out and tell you exactly what to do.
It's a weird thing because, people don't realize, like, sometimes people look at, I know great holistic vets that are charging between 100 and, $600-700 an hour or a session, and people go, but dig into people's biographies, look at their CVs, look at their history, look at their experience. And when you have somebody great, I'm going to rephrase what you just said. It shaves off so much time of healing, and time is usually the thing you don't have a lot of. So, like, for example, valley fever. If you think you've got it, or you've got a blood test, you got to fix it. And if, your dog's got, a parvo or something, you really have no time. If your dog is dealing with a degenerative disease or, God forbid, a cancer diagnosis, no time. Get help that actually, get real potent help. And, it's fine to Google. It's fine, but don't hang your hat on a search engine and all of the different, everybody, you're playing with time, and time is just the thing you just don't have a lot of. So I always feel really stressed out for people who have their own cancer diagnosis in the human world or dogs that, any of these horrible diseases. It's just time is not on your side. And that's the thing. You need the advantage.
Mm-hmm. Yep. You need to contact the expert. Mm-hmm.
Yeah. Yeah. So, and the other thing too, is you're not just Google. You're not, if somebody's consulting with you, you're not just a machine of keywords. You're thinking around okay, this dog is this old, it's this breed, it's this history, it eats this food, it lives in this environment, and so on and so forth. Google can't do that. I know that Google would love to think that they can do it, but any of the ChatGPT and all that, it's just not yet possible. And I think, no, the human brain and the ability to think through problems and the clinical experience of somebody, I just think we're probably a good, I don't know, maybe 50 years away from it being truly, important. Before I forget, we'll put up on the screen, if anybody would like to get the Valley Fever course, if you're in those southwestern states that Dr. Dragos mentioned, and even if you're not, if you're in Washington and you want to take a look at this, we have a link. We've linked up to it, and we'll just go right to VF for gussysgut.com/VF for Valley Fever, the 2 initials. Okay, so let's move on. You're also one of the other facets that I find so interesting about you. You're also a co-developer of a raw diet, and that's what we love over here. And it's called the Canine Ancestral Diet. So how did you get into that?
I kind of fell into this company, Canine Ancestral Diet, through a client of mine that hooked me up with the owner because he wanted some help with it. And
Okay.
The food at the time was kind of okay. And I said, if you want my help, you're going to have to make some changes. And I reformulated it along with another nutritionist and made it into a really cool food. So it's a really nice raw diet out of Parker, Colorado. It's a small company, but it was fun.
Awesome. Well, it's not very far from me. I'm in Colorado, so I'll have to take a look. Canine Ancestral Diet. It's a balanced frozen raw commercial dog food. True?
True.
Okay. All right, great. So let's talk about what you do the most in your consultations. So maybe let's do a two-part question. What is it you enjoy doing in your consults the most, just personally? And then what is it you get the most of in your consultations?
So the things that I enjoy with my consultations is really being the detective and trying to figure out what exactly is wrong and why the dog isn't getting better, because I'm sometimes the last chance for the patient. They've done everything and nobody can figure it out. So being the detective and figuring out what's wrong with the dog is really, I find that fun. And I use not only conventional ways to do that, like blood work and looking at the x-rays or the MRI images, but I also do that with holistic medicine. So I have them send me a picture of the pet and a picture of the pet's tongue, which is kind of difficult, but a lot of times I get videos of dogs or cats drinking and eating so I can see the tongue. And I have a nice big form to fill out with all these really weird questions. What do things look like, and what's the personality, and all kinds of things that a conventional vet won't ask you. So I really enjoy going over all the records and all the information and trying to boil it all down and then come up with a specific plan. And I tailor it to the pet and the pet owner so that things that they have to do to get the pet better are easy.
It's so sad to me that the folks that go the ultra conventional route, what ends up happening, it seems to me, I've interviewed plenty of vets by now, but it seems to me what ends up happening is you get farther and farther away from being a problem solver, and you're just into checking boxes, and it's like you're coloring by numbers. And no disrespect to conventional veterinarians, but I think the way that they have to practice is it's much less personal and therefore less problem solving specific to a dog, and more just formatted. Which is what pharmaceuticals are so great about. If you're a pharmaceutical company and you're a conventional vet, it's, this is this category, prescribe this, and we're done. Like, it's a 3-minute appointment. And the other thing too is I see so many appointments that most people don't realize. People have only been in holistic vets their whole life, think it's normal to have a 3 to 6 minute interaction with a veterinarian, and 10 minutes to 20 minutes with a vet tech who just kind of tells you all the things that the veterinarian didn't tell you. And so you might have a 30-minute appointment, but you really only got about 6 minutes with an actual vet. It's completely the opposite. Like, with holistic vets, you're sitting on the floor with your veterinarian. They're sitting, their legs are crossed, they're calm, their hands are folded, and they're really asking you and digging into a lot of very specific things. I don't know how you do health any other way. I just don't know how we got away from it. It's almost like your type of medicine is like the old time doctors with the shingle on the door who had to know all sorts of things and think
Yep.
like, holistically of like everything, and therefore holistically what the solution might be. So yeah, it's really troubling. I feel bad for the veterinarians that have, there's just no problem solving. I think that's why every veterinarian wants to be a vet, it seems to me.
Yeah. The corporate practices are becoming more like the, human healthcare, where it's high volume and low touch, and that's just not the way to practice. And the vets don't enjoy it. They get burned out.
Yeah, get it burned up pretty quick. Well, yeah, it's just, I think you don't become a vet to, if you want to get rich, you go and you work at a, some up in Wall Street and do something like that, some hedge fund or something. You go into veterinary medicine because you love animals, you're passionate about solving problems for animals. But then something happens during that schooling process where you get indoctrinated into a system that is designed, as you said, for volume, and and that does not afford the ability to dig into a case and solve problems. So I just always feel very, I would just be upset if I went to a very expensive vet school and had, over 100,000 plus in loans. And at the end of the day, I wasn't I was pushing drugs. I wasn't curing animals.
Mm-hmm. And that's why a lot of conventional vets are finding holistic medicine. They get burned out with that kind of practice. And instead of just leaving vet medicine altogether, they find holistic medicine somehow, and it really saves their lives. And they become happier, and they're helping their patients better, and they're helping their clients better too. It's
interesting. Well, that's great. So tell me what you are, what are you like the most excited about? Because you have so many different tools in your tool belt, Chinese medicine, botanical medicine, which weren't you the past vice president
of
botanical?
ACVBM, the College of Veterinary Botanical Medicine. Yeah, I'm actually president-elect right now. I'm moving up.
Oh boy. Okay. So of all the things you use in terms of tools in your tool belt, in your arsenal of tools, like what is it, the one that you love working with the most?
Well, I love the herbs because they're more like a prescription. So herbs are medicine, and they're extremely strong. So when I do a consultation, diet is going to be your basic issue that's going to help the herbs work. So you have to have that baseline, but the herbs are going to specifically go after whatever the issue is. So the root cause of whatever the problem is, as well as all the other problems that are the result of that. So that, the herbs are just really fun, but it takes an expert to figure out what exactly the pet needs as far as the herbal medicine, because there is an infinite amount of possibilities of combining herbs.
Yes, there are. And this again is like going back to, for the dog's sake and the cat's sake, I'll drill this into everybody, even though I'm sure I sound like a broken record. This again is why you get really great people in your healthcare team, because they're spending years and years and years, and they're prescribing, and they're looking at what works, and they're in real clinical background, real clinical experience and environments, and they're able to see on the ground what is actually working for dogs and cats under a lot of specific conditions. So yeah, that whole herb line, TCVM, Chinese herbs, more, what would you call it? American herbs? There's,
Western herbs. Yeah. Western herbs.
Western herbs. Thank you. Yeah. I don't know why I was blanking on that. Western herbs. Those are it's just a very, it's just, I don't think you can really even get good. What would you say within 3-4 years is probably the minimum it takes to get really good with
Oh,
practicing with herbs?
At least, because you have to
At least
first know the herbs and then you have to use them and know what they do.
Yeah. Yeah. So folks, it's just what you're buying and paying for is this. It's not just book knowledge, which is available in Google. It's this on the ground in the dogs and cats use of these modalities, these products, or these, things like chiropractic or acupuncture or whatever it may be. Boy, it's just really profound. Okay, so one of the things I read about you said somewhere like you like to use the gentlest therapies first, which I thought was so beautifully said. Tell me about that philosophy and why.
I think the way I practice now is very good for the pet, because I don't want to stress the pet, because I think stress causes more problems. So when you step back and you practice gentle methods of healing, such as acupuncture and chiropractic, the way we do it, the way veterinarians do it, is actually very gentle. It's not the rough stuff. And then I would consider herbs a gentle therapy. So that's really important to me because it helps my patients heal better when they're not worried about seeing me.
Yeah. Interesting. So give me an example of, like, I don't know, is there an example you can give me off the top of your head that is like, if somebody's listening to this and they're like, I still don't understand, what does it mean by gentle? Because they're thinking this one way in the context they have. I have something in my head, like if there's a couple ways you can go with a specific condition, you're choosing, tell me if I'm right about this, you're choosing the thing that is lowest hanging fruit, easiest on the system, least toxic, least invasive, gentlest. Is that fair?
Correct. So, for example, like with the dog with cancer, the gentle way to approach that is with herbal chemotherapy as opposed to your conventional chemotherapy. Or even if you do a combination, if you do the herbal, it's going to reduce the amount of conventional pharmaceuticals that you need. So that's going to be more gentle on the system.
Okay. Yeah. Yeah, because a lot of times you could be faced with a choice or multiple choice set of options of, especially in cancer, but even in just lesser conditions, ear infections and such, you could go the route of like a outpatient kind of quasi-surgical, like where the dog has to be sedated. You could go full on surgical. You could go, holistic wash, super duper holistic. But it's funny because when you're faced with these things, you don't have time to think that. If you're a pet owner that you don't know, you're like, oh my gosh, I came in here, I didn't even know what was wrong with my dog. Now I found out. Now I'm faced with 3 different choices. Like, somebody help me figure out what to do first. What is best for me.
Yes, and you won't get you won't get the holistic viewpoint either. So you need to find someone that will give you that viewpoint. So with the ear issue, I actually had a dog come in that they had recommended an ear ablation, where they actually do a surgical procedure to remove the infected inside of the ear. And it sounded horrible, and it's not that great. It is pretty aggressive. So they came to me for an alternative. And with herbal medicine and acupuncture, got that dog's ears normal. No surgery.
Yeah.
There's always an alternative.
I have a story about, there is, and I have a story about that I think is really interesting. So my dog, my second dog, yellow lab, beautiful. His name was Owen. He had chronic ear infections, no matter how good the diet. It just was part of his genetic cross to bear. And he was under great care and lived a great life. But he would occasionally get these ear infections. Well, I had been traveling and he had a series of ear infections. And then before I knew it, and I'm very on top of, I mean, I work at home. I'm with my dogs all the time. I'm on top of them. But he managed to get scar tissue in this ear. You couldn't really tell these ears were infected. So I brought him, it got to the point where I brought him to already had ear rinses and stuff that I was doing for him. And I was given the news that he was going to have a sublation. And there was scar tissue in there. And he might have to lose his eardrum, which he might lose his hearing. And that was like, you could have hit me in the back of the neck with a sledgehammer. So I was, very emotional, very distraught about that. I left and I rang up my doctor, the same doctor who cured my sleep disorder issue. And he said, I said, do you have any idea of what I might be able to do for him with his ear? And I said, here's the deal. He could lose his, they want to do surgical. And this is a holistic vet that wanted to do this. So that I, trusted and was under great care with. And he said, there is a German homeopathic that is actually not made for ears. But one of the side effects that they're noticing is it dissolves scar tissue. And I said, I remember where I was having this phone call. It was like a huge epiphany. I was actually at the Denver airport in the baggage claim talking to him. He called me back. Germany, put him in his ear 3 times a day. 4 weeks later, my vet said to me, was it in his left ear? And I said, when she said that, I said, no. And it worked. And of course I did the other ear washes, but it was all the stuff I was already doing. I was just doing the same stuff. And I just said, I'm not going to make this decision for a few weeks. And I gave 4 weeks. I said, will that be okay? Nothing even more horrible will happen if I give it 4 weeks. She said, yeah, 4 weeks is fine. You can make a decision in 4 weeks. So I took fast action. I had a great healthcare team. And I tried this. And I'm telling you, I have miracles like that. Like people just won't believe the miracles I have. And it's just from having really brilliant people around me that, I tell my story. I know I can communicate what a problem is. And then I listen and do what they say. That's like the secret to my success.
Yeah, it's good to get a different opinion. Very interesting. There's always another option.
Yeah. There's always options. I mean, that's the other thing too, is hope. It's just so wonderful to, it's like one of the joys of what I do here at Gussys Gut and on this show. And as I talk to healers and the mind, like the way that somebody thinks around a problem is so fascinating, that, like some people, like it's like talking to architects or, anybody brilliant in their profession, how they think around solving problems and making things happen. Healers are, at the top level of that. People who think around nutrition and what nutrients do and all that. Let me ask you about nutrition. And I don't know if you spend a lot of time on social media?
A little bit now. I'm learning.
Okay, fair. So, what do you think about like this proliferation of, quote, nutritionists and like this whole idea, like everybody's, playing tug of war with like it's feeding this way, feeding this way. What is your philosophy on nutrition?
So I think nutrition is very individual to the patient. So there are some dogs or cats or pets that do fabulous with a raw diet, but there are some that don't. So I have to tailor nutrition to the particular patient.
Yeah. Interesting. Yeah. And do you follow like the diet you helped formulate has the word ancestral in it. So I would imagine this is all raw for the most part.
Yes. So that's a raw diet. Yep. So a raw diet is generally the best if they can tolerate it. And that's something that we work on getting towards, is to have them on a raw diet, because that would be ideal. But initially, when a pet is really sick, they may not be able to tolerate that. So it's a progression.
Sure. And that's because, give us your reason why that might be, because I've certainly heard of that, and I've never had that experience with my dogs, but I understand there are dogs that have that. So why is that they need time to like tolerate it? Give us some examples.
So one of the big examples would be if a dog is sick, a raw food takes a lot of energy to digest, and sometimes more energy than they really have. So they need something a little easier to digest so that they can focus on healing from whatever chronic disease they have. So we have to just do a gently cooked thing initially till we get them stronger. And then when they're strong enough to digest the raw food, then we move to that.
Okay, that's fair. So on that note, do you believe in fasting?
Absolutely.
Yeah.
Tell me,
what do you tell people?
Yeah, I actually talk about that in my Valley Fever program. So I do kind of a modified fast where I feed in an 8-hour window, and then they fast the rest of the day, and just do that periodically so that the body can reset the immune system and clean up all the garbage in the body.
Yeah. Interesting. And tell me what your philosophy is, your thoughts are on intermittent fasting.
Oh, I think it's great to do like a once a week fast in particular patients. So if they're too sick to do that, I don't. But if they're generally in good health, then a weekly fast is a fabulous idea. And one of the things that I see a lot is people really want their dogs to eat twice a day. And some dogs don't want to. They're fine eating once a day, and the dogs know what they need. So I help people not stress about their dog not eating twice a day. And if the dog eats just once a day and is very happy with that, then that's what he needs. And that's a modified fast.
Yeah. That's right. Again, your philosophy is very individualized, specific to, the patient. And, but it is interesting that, like, I've only fed, except for when they're puppies and they need to eat more calories 3 times a day, they have smaller stomachs. The once a day has always been my go-to. And also the other thing too, is if you start giving treats throughout the entire day, you're really breaking an intermittent fast. Mm-hmm. So, I would include treating in that realm. What is it with us that we constantly have to be throwing food in our animals' face? It's like, it's interesting.
Yeah, I don't know. I don't do a lot of treats with my dogs. They just get fed raw food, and they're very happy with that.
Yeah. That's very interesting. So real quick, I want to just remind everybody, if you're curious, is this time of year really big Valley Fever time of year? Is that
we're in a huge we're in Valley Fever season right now. So we had the spring rains where the fungus grew like crazy, and now it's all dried out and almost 100 degrees. So all the spores are getting airborne. So as soon as we get a nice wind, then we're going to start seeing cases within a few weeks in people and pets.
Yep. Is there, by the way, I'll put our website up so you can take a look at the course, gussysgut.com/VF for valley fever. Is it something that, like, is there even a vaccine for it? And if there is, what thoughts do you have on that?
Yeah, funny you should say that, because there was just an article out. So the Valley Fever Center for Excellence at U of A in Tucson just announced that the valley fever vaccine is being tested and should be approved by the FDA hopefully this year in dogs, which will, once we do that in dogs to prevent valley fever with the valley fever vaccine, then they're going to move to people and try to get one for people too.
What are your thoughts on if next week it was to come out, how do you feel about that?
So it's kind of the vaccine debate. So my thought is, a vaccine's great. It can prevent a dog or a person from dying. But I think what's more important is your immune system or your terrain. So everything else that's involved in keeping you healthy and not relying on a vaccine. So you have to take care of your body, take care of your immune system with your lifestyle choices and your diet choices and exercise and all that. That becomes very important. I think more important than a vaccine.
Yeah, right. Well, I agree with you on that. I mean, I feel like it's fine to get a treatment, a vaccine, but what seems to have happened is we've given up on the idea that we can, through natural immunity, our innate immune systems, taking care of it. We've just given up on that. Mm-hmm. And we've gone to this external thing that we hope will save us. It's sort of interesting, that idea.
Yep. It'll give you a false sense of security. Like you don't have to do anything else. Where you really, the more important thing is taking care of yourself.
Yeah, right. It sure is. Well, Dr. Dragos, this has been amazing. I really appreciate you telling us about valley fever and your thoughts on getting a person in your corner, a health coach, a health professional, a veterinarian, holistic veterinarian in your corner. And, at our company, we're going to be putting up a page that will help show people some really great, very different veterinarians. And you get to choose who you work with because it's very personal. And that's one of the reasons I think this show is so important. It's to see all these different veterinarians and their styles, their approaches, and people get to choose who they work with, who they think fits the best with their, not just your personality. I think that's the least important thing. I think it's your sensibilities and your comfort levels with treatments. Some vets are more gentle, some are more aggressive on things, and it's being able to hear veterinarians and talk through how they approach problems. I think that's how you know if you're going to find a really good veterinarian.
Absolutely. Yep. You have to find a vet that you resonate with.
Yeah. Well, Dr. Dragos, thank you so much for spending the time today. And thanks everybody for watching. If you have any questions on valley fever, you just go to gussysgut.com/VF. And then Dr. Dragos' website for consults is Dr. Pamela Dragos.com, DRAGOS.com for our folks that are listening on regular audio only podcast.
Thank you, Rob.
Have a great day.
Thank you. You too.